Climate also means more frequent and more severe storms and flooding. That puts people at immediate risk of being injured or killed by debris, downed power lines, or floodwaters. After a severe storm or flooding event, possible health risks are contaminated food or drinking water, bacteria, viruses, and toxic chemicals in floodwaters, mold, and difficulty accessing healthcare services like emergency help, prescribed medications, and supplemental oxygen. In these events, older residents, people with disabilities, and lower-income households are more at risk. They may all have a harder time fleeing from a storm and may face more health risks if they can't evacuate. One thing we often miss: the mental toll. First responders who witness countless tragedies and residents who are forced to flee are more vulnerable to anxiety and depression, even those who have no history of mental illness. To prepare, communities can find out which neighborhoods, people, and resources are most at risk, upgrade infrastructure such as roads and sanitary sewer systems, and educate residents on how to stay safe during and after an extreme weather event, such as avoiding driving in flooded areas. As average temperatures rise across the globe, air quality can also change. That looks like longer and stronger pollen seasons, which can trigger asthma attacks and allergies, hotter temperatures and changing weather patterns, which can make air pollution worse by increasing the density of dangerous particles, and more frequent droughts that can lead to wildfires, which release dangerous pollutants into the air. Young children, people with asthma and respiratory conditions, older adults, and people with compromised immune systems are more at risk of being harmed. Work that can help communities prepare includes collaborating with community partners to set up health-focused air quality alert systems and educating residents on how to check alerts to know when it's safe to exercise outside. Now, let's talk about these little guys: pests. Change to our climate can also mean more risk of diseases spread by pests like ticks, mosquitoes, fleas, and rodents. With higher average temperatures, diseases transmitted by pests can multiply faster, spread to more locations, and infect people over longer periods of time each year. Lyme disease, West Nile virus, Zika, and hantavirus are examples of the resulting health risks. People who spend extended time outdoors in areas where pest-borne diseases are common are most at risk. Communities can prepare by creating systems to track and assess population health effects and working with local partners on outreach strategies to help residents protect themselves, such as staying out of certain areas and using insect repellent.
All right. So first, I'm going to list some quick facts. Climate change affects clean air, safe drinking water, sufficient food, and secure shelter. Between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year. The direct damage cost to health is estimated to be between $2 to $4 billion per year by 2030. Areas with weak health infrastructure will be the least able to cope.
So let's start with the most well-known aspect of climate change: global warming and extreme heat events. Extreme heat events have long threatened the public health in the United States. Many cities, including St. Louis, Philadelphia, Chicago, and Cincinnati, have suffered dramatic increases in death rates during heat waves. Death resu- Deaths result from heat stroke and related conditions, but also from cardiovascular disease involving the heart, respiratory disease affecting breathing, and cerebrovascular disease involving blood vessels that supply the brain. Heat waves are also associated with increased hospital admission for cardiovascular, kidney, and respiratory disorders. Extreme summer heat is increasing in the United States, and climate projections indicate that extreme heat events will be more frequent and intense in the coming decades. Some heat-related illness and death risks have diminished in recent decades, possibly due to better forecasting, heat health early warning systems, and/or increased access to air conditioning in the U.S. population. But extreme heat events remain a cause of preventable death nationwide. Urban heat deaths, combined with an aging population and increased urbanization, are projected to increase the vulnerability of urban populations to heat-related health impacts in the future. High temperatures also raise the levels of ozone and other pollutants in the air that exacerbate cardiovascular and respiratory disease. Pollen and other aeroallergen levels are also higher in extreme heat. These can trigger asthma and ongoing temperature increases and are expected to aggravate this burden.
So let's define allergies and asthma. Allergies are a common chronic condition that happen when the immune system is introduced to an unknown irritant as foreign and overreacts to it by producing antibodies, even if it is not harmful. Seasonal allergies to pollen can be very uncomfortable. Symptoms include skin and eye irritation, sneezing, nasal congestion, difficulty breathing, and wheezing. Longer warm seasons result in longer pollen seasons and therefore longer allergy seasons. Higher temperatures, changes in precipitation, increased carbon dioxide levels, and changes in plant growth patterns all contribute to a longer and more intense allergy season. For example, higher carbon dioxide levels increase pollen levels and pollen potency. Longer and more intense pollen seasons have negative effects on the respiratory system, especially among those with allergies or asthma. Asthma is a chronic lung disease that causes inflammation and closing or tightening of the airways. It leads to coughing and trouble breathing as airflow to the lungs is reduced. While asthma affects all population groups, some groups are at higher risk. Black people are 3 times more likely than white people to be hospitalized and to die of asthma. Puerto Ricans have the highest rates of asthma attacks and related deaths. While allergies and asthma are two separate health conditions, there is a relationship between them, known as allergy induced asthma. Allergic reactions can affect the lungs and airways, leading to asthma symptoms. Climate change makes our air less healthy to breathe, and poor air quality can affect allergies and asthma. Both conditions can decrease school attendance and workplace productivity.
Now we're going to talk about air pollution. Climate change is projected to harm human health by increasing ground level ozone and or particulate matter air pollution in some locations. Ground level ozone, a key component of smog, is associated with many health problems such as diminished lung function, increased hospital admission and emergency room visits for asthma, and increases in premature deaths. Factors that affect ozone formation include heat, concentration of chemicals, and methane emissions. Particulate matter concentrations are affected by wildfire emissions and air stagnation episodes, among other factors. By increasing these factors, climate change is projected to lead to increased concentrations of ozone and particulate matter in some regions. Increases in global temperatures could cause associated increases in premature deaths related to worsened ozone and particle pollution. Estimates that assume no change in regulatory controls or population characteristics have ranged from 1,000 to 4,300 additional premature deaths nationally per year by 2050 from combined ozone and particle health effects. Less certainty exists about the responses of airborne particles to climate change than the response of the ozone. Health-related costs of the current effects of ozone air pollution exceeding national standards have been estimated at $6.5 billion nationwide, based on a U.S. assessment of health impacts from ozone levels during 2000 to 2002.
In 2020, we had some very bad wildfires on the West Coast. These wildfires can affect our health in many ways, and climate change is increasing the vulnerability of many forests to wildfires and is also projected to increase the frequency of wildfires in certain regions of the United States. Long periods of record high temperatures are associated with droughts that contribute to dry conditions and drive wildfires in some areas. Wildfire smoke contains particulate matter, carbon monoxide, nitrogen oxides, and various ozone precursor chemical compounds, and can significantly lower air quality, both locally and in areas downwind of fires. Smoke exposure increases respiratory and cardiovascular hospitalizations, emergency department visits, medication dispensations for asthma, bronchitis, chest pain, chronic obstructive pulmonary disease, or COPD, a lung disease that blocks airflow to the lungs and can make it hard to breathe, respiratory infections, and medical visits for lung illnesses. It has also been associated with hundreds of thousands of deaths annually, based on an assessment of the global health risks from landscape fire smoke. Stanford in 2020 did a study using data, the electronic medical record system in their emergency department. They used health emergency data to compare times when the wildfires were raging versus when they were not. They found increases in asthma, heart attacks, and strokes during the week of wildfires compared to the week prior. They also found that people over 65 have a higher chance of heart attacks and strokes even after 2 to 3 days of bad air quality due to wildfire smoke. The smoke from wildfires goes through the lungs and the airways and can be absorbed into the blood. There are over 400 toxins associated with wildfire smoke, which have a multitude of bad effects on the body. In the blood, these toxins can activate the immune system and platelets and the lining of blood vessels. When this happens, the inflammation can induce clots, which lodge in the heart or the brain vessels and can cause heart attacks or strokes. Asthma can get worse with wildfire smoke because the smoke gets into the lungs and causes irritation and muscle spasms, which lead to wheezing and difficulty breathing.
On the other end of climate change effects, the frequency of heavy precipitation events has already increased for the United States as a whole, and is projected to increase in all U.S. regions. Increases in both extreme precipitation and total precipitation have contributed to increases in severe flooding events in certain regions. Floods are the second deadliest of all weather-related hazards in the United States, accounting for approximately 98 deaths per year, mostly due to drowning. Flash floods and flooding associated with tropical storms result in the highest number of deaths. In addition to the immediate health hazards associated with extreme precipitation events when flooding occurs, other hazards can often appear once a storm has passed. Elevated waterborne disease outbreaks have been reported in the weeks following heavy rainfall, although other variables may affect these associations. Water intrusion into buildings can result in mold contamination that manifests later, leading to indoor air quality problems. Buildings damaged during the hurricanes are especially susceptible to water intrusion. Populations living in damp indoor environments experience increased prevalence of asthma and other upper respiratory tract systems, such as coughing and wheezing, as well as lower respiratory tract infections, such as pneumonia. Globally, the number of reported weather-related natural disasters has more than tripled since the 1960s. Every year, these disasters result in over 60,000 deaths, mainly in developing countries. Rising sea levels and increasingly extreme weather events will destroy homes, medical facilities, and other essential services. More than half of the world's population lives within 60 kilometers of the sea. People may be forced to move, which in turn heightens the risk of a range of health effects, from mental disorders to communicable diseases. Increasingly variable rainfall patterns are likely to affect the supply of fresh water. A lack of safe water can compromise hygiene and increase the risk of diarrheal disease, which kills over 500,000 children of 5 or younger every year. In extreme cases, water scarcity leads to drought and famine. Floods and extreme precipitation are increasing in frequency and intensity. Floods contaminate fresh water supplies, heighten the risk of waterborne diseases, and create breeding grounds for disease-carrying insects such as mosquitoes. They also cause drownings and physical injuries, damage homes, and disrupt the supply of medical and health services.
We are now going to watch a short video about climate change and diseases.
Our climate is in crisis. Our health is at stake. Cholera, Zika, malaria, these are diseases of our worst nightmares. Today's warming weather is creating perfect conditions for these infectious diseases to spread farther and faster than ever before. And it's all part of a bigger picture. Here's what the climate connection looks like. Climate change makes oceans, lakes, and other bodies of water warmer, which in turn allows pathogens like bacteria and toxic algae to thrive. The water we use to drink or bathe in or even play in can easily become a source of disease in these conditions. Millions of people around the world could be affected. While heat helps pathogens grow, extreme weather events like hurricanes and floods can spread them even further. And disease can spread through animals, like mosquitoes that transmit viruses and bacteria directly through bites. When it comes to public health, mosquitoes are public enemy number one, killing more people each year than all human violence and all other organisms combined. Hotter temperatures mean that mosquitoes, ticks, and other carriers can survive and thrive in more places across Earth, living longer and reproducing faster. The result? Diseases like Lyme, dengue, and yellow fever can all increase their reach and spread more quickly than ever. These diseases affect us all, but like so many climate impacts, they hit people in developing nations hardest.
Climate change is expected to threaten food production and certain aspects of food quality, as well as food prices and distribution systems. Many crop yields are projected to decline because of the combined effects of changes in rainfall, severe weather events, and increasing competition from weeds and pests on crop plants. Livestock and fish production are also projected to decline. Prices are expected to rise in response to declining food production and associated trends such as increasingly expensive petroleum, which is used for agricultural inputs such as pesticides and fertilizers. While the US will be less affected than some countries, we will not be immune. Our health can be affected in several ways. First, Americans with particular dietary patterns, such as Alaska Natives, will confront shortages of key foods. Second, food insecurity increases with rising food prices. In such situations, people cope by turning to nutrient-poor but calorie-rich foods, or they might endure hunger, with consequences ranging from malnutrition to obesity. Third, the nutritional value of some foods is projected to decline. Elevated atmospheric carbon dioxide is associated with decreased plant nitrogen concentration and therefore decreased protein in many crops, such as barley and soy. The nutrient content of crops is also projected to decline if soil nitrogen levels are not optimal, with reduced levels of nutrients such as calcium, iron, zinc, vitamins, and sugars. This effect can be alleviated if sufficient nitrogen is supplied. Fourth, farmers are expected to need to use more herbicides and pesticides because of increased growth of pests and weeds, as well as decreased effectiveness and duration of some chemicals. Farmers, farm workers, and consumers will be increasingly exposed to these substances and their residues, which can be toxic. Impacts of climate change on the nutritional value of food exist within a larger context. Other factors, such as agricultural practices, food distribution systems, and consumer food choices, also play key roles. Adaptation activities can reduce the health-related impacts of some of the anticipated food security challenges.
Mental illness is another one of the major causes of suffering in the United States. The extreme weather event can affect mental health in many ways. After disasters, mental health problems increase, both among people with no history of mental illness and those at risk. These reactions may be short-lived or, in some cases, long-lasting. For example, research demonstrated high levels of anxiety and post-traumatic stress disorder among people affected by Hurricane Katrina, and similar observations have followed floods and heat waves. Some evidence suggests that wildfires have similar effects. All of these events are increasingly fueled by climate change. Other health consequences of intensely stressful exposures are also a concern, including preterm birth, low birth weight, and maternal complications. Some patients with mental illness are especially susceptible to heat. Suicide rates vary with weather, rising with high temperatures, suggesting potential impacts from climate change on depression and other mental illnesses. Dementia is a risk factor for hospitalization and death during heat waves. Patients with severe mental illness, such as schizophrenia, are at risk during hot weather because their medications may interfere with the temperature regulation or even directly cause hypothermia. Additional potential mental health impacts, although less well understood, include the possible distress associated with environmental degradation and displacement, and the anxiety and despair that knowledge of climate change might elicit in some people.
We're now going to show you a video that has some solutions. This video is from the World Health Organization in Southeast Asia, but the information is still relevant to us in the United States.
Is what can the health sector really do? We need to start by educating ourselves, each and every one of us. A healthier population will be far more resilient to climate change. Health system as a whole also needs to be reinforced and replanned by integrating the risks of climate change in their very building blocks. At the forefront of a health system is its workforce. We need a well-trained health workforce that is able to respond effectively and quickly. It is important to understand and acknowledge different vulnerabilities in each region. We need to carry out extensive research to understand the local impact of climate change. Climate data must be integrated into health information systems and disease surveillance. Health sector as a whole can lead by example and reduce its carbon footprint. Healthcare facilities should not only be environmentally friendly, but also climate resilient. All sectors that have a direct impact on health need to come together in order to bring actionable change. We need to integrate climate change risks into emergency preparedness and management program. Both current and future climate risks should be considered while designing health program. Identifying resources and mobilization of funds is also needed. For all this to happen, we need strategic planning backed by a strong leadership. A new wave of awareness is evident throughout the region. Climate change is now a critical factor in national level action plans. All countries have actively started training frontline health workforce. Critical weather data is now a key factor in the control of climate-sensitive diseases. Integrated disease surveillance has been initiated in one country. New heat health action plans and early warning systems are in rapid development in 3 countries. We've seen multiple sectors working together to establish disaster management units and green hospitals in 5 countries. The World Health Organization and its partners have so far been successful in generating external funding for 5 countries to improve their levels of preparedness and adapt to climate change. These brilliant examples testify towards a new wave of awareness and responsibility. But a lot needs to be done, even now. What's important is not what's gone, but what remains on this blue planet. We know the solutions. We all have the power to change. It's time to come together and become the change. So, what are we waiting for?
Today, we talked about how climate change effects like rising temperatures, extreme and unpredictable weather, increasing carbon dioxide levels, and rising sea levels have a health impacts on people. Let's review some of these impacts. There are more pollutants in the air as a result of high heat and wildfires. Floods result in death as well as increased water and airborne diseases. Increasingly variable rainfall patterns are likely to affect the supply of fresh water. Many crop yields are predicted to decline and prices are expected to rise. Mental health and PTSD can increase as a result of stressful natural disasters like Hurricane Katrina. Those with pre-existing mental illness are more likely to suffer greatly from extreme heat events. So let's talk about what you can do now. Since many of you in the audience are students, one of the best ways to get involved and combat these effects of climate change is by getting involved in your local organizations. One of them is the New Haven Climate Movement. The New Haven Climate Movement is an intergenerational grassroots organization of New Haven area residents. In 2018, we passed the New Haven Climate and Sustainability Framework, which outlines key strategies to address the climate emergency in New Haven. We also passed the New Haven Climate Emergency Resolution in 2019, which calls for zero emissions by 2030, and a city climate mobilization task force. In 2020, we got the city to commit to $560,000 in capital funding towards climate infrastructure projects through our 0.1% for the future proposal, as well as $50,000 in their general 2020 budget towards climate solutions. But if New Haven is going to create a sustainable and just city for all with net zero carbon emissions and a resilient economy, there is so much work left to be done. Some of our current projects include Climate Justice and Green Jobs Fund, Climate Education, Electric Future, and the CT Green New Deal.
CHEP, on the other hand, the Climate Health Education Project, is an online resource for educators who want to bring climate education into their schools. We have different types of resources for English, social studies, science, and art classes, as well as clubs and student-led activities. There are 7 current interns at high schools all around the New Haven area, creating and distributing climate educational materials, organizing webinars just like this one, producing educational videos and graphics, engaging teachers and administrators, and organizing teacher workshops on climate education. So that is our webinar. Thank you for coming and learning about climate and health. If you have any questions, please email me or Bella. Our emails are right there. And please visit the CHEP website, climateeducationnh.org. We also have an Instagram and a Facebook. And then if you want to know more about climate change and health, you can look at the CDC website. I got a lot of information from there for this presentation, so that is a great source.
Thank you guys for coming, and we hope you have a great night and a great weekend.